This video will explain how to perform a rapid test for syphilis. Before you start, please read instruction, including test procedure, listed in the leaflet. Wash your hands before testing. Make sure your hands are dry. Before performing the test, allow the test cup to equilibrate to room temperature, 15 to 30 degrees Celsius. Check you have all components listed on the packaging, and ensure you have a clean work surface to lay out your test components: cassette pouch, lancet, diluent and capillary dropper, alcohol pad, instruction. Open the pouch and remove the test cassette. Rotate and pull out the lancet cap. Clean your middle fingertip with the alcohol pad. Allow to air dry. Prick your finger at the side, as it's less painful than at the tip. Wipe the first drop of blood with alcohol pad. Give a little squeeze to get more blood. Squeeze the capillary dropper bulb. Put it on the blood. The blood will migrate into the dropper. Release the 2 drops of blood into the S well. Wait for the blood to be totally dispensed in the well. Add 2 drops of buffer into the S well. Wait for the colored lines to appear. Read the results at 10 to 30 minutes. Do not interpret the result after 30 minutes. Only control line, C, appear. The results show that syphilis antibodies are not detected in the samples.